In this presentation, we will be talking about building protective factors with families regarding child abuse prevention. This presentation is based on the Strengthening Families Through Early Care and Education initiative developed by the Center for the Study of Social Policy with funding from the Doris Duke Charitable Foundation. In this presentation, you'll be learning about 5 protective factors. And a protective factor is sort of like the opposite of a risk factor. Instead of looking at what characteristics make a child or family more likely to have negative outcomes, we look at what characteristics make people more likely to have positive experiences and more likely to have positive outcomes despite the risk factors they might face. In this initiative, we focus on protective factors that make children and families less likely to experience child abuse and neglect. One of the protective factors relates to children, and the other 4 are about parents. We're going to talk about what it means to care for children, because it also means supporting their parents to keep their family strong. As mentioned before, this training comes out of an initiative called Strengthening Families Through Early Care and Education. Wisconsin was one of the first states to start implementing this initiative, but it's happening all over the country now. Strengthening Families is built on 2 key beliefs. All families have strengths, and all families need support. It might be hard sometimes to see families' strengths. Some other families might already be getting all the support they need. Most families are probably somewhere in the middle. Strengthening Families is not like a traditional child abuse prevention program that targets certain families because of risk factors. The idea is to use early care and education programs to reach a huge number of families and focus on protective factors that all families need. As we talk about the protective factors, you're going to see that these are characteristics your family has and the families you know have them. All families need these protective factors, and we all need support to develop them. A lot of us get that support from our families, friends, partners, and so on. At different times in our lives, we may need support from outside those informal networks to develop or maintain our protective factors. This model shows 5 protective factors that protect children from abuse and neglect. We're going to talk about each of the protective factors listed here and how an early care and education program can build the protective factors to strengthen families. Now, these are not the only protective factors that keep families strong. They were selected because they are the ones that you in your program can build for families. Social-emotional issues of young children are becoming an increasing issue in early care and education settings. In addition to preparing kids for school and dealing with problems before they get too serious, promoting children's social-emotional competence also changes how they are parented. Promoting social-emotional competence actually refers to activities on 3 different levels. All children need opportunities to learn how to relate to others, express their emotions, and solve conflicts. For typically developing children, what they bring home from the program will affect how their parents react to them. Parents react positively when their 4-year-old talks about his emotions and knows how to resolve conflicts with words. Now, looking in the second quadrant or the second part of the pyramid, for children who have challenging behaviors, whether they are indicative of more serious problems or not, how we respond to that behavior will affect a child's development and how their parents deal with it as well. Resolving those behavior problems will promote a healthy, positive relationship between the child and her parents. Appropriate adult response to behaviors while in the program helps the child to control his or her behavior. Role modeling that type of response for parents is also helpful. Finally, looking at the top of the pyramid, for those children who have serious social-emotional difficulties or who have experienced trauma, we need to pay special attention to those or to their social-emotional development and help their families get the services that they need. Teaching social and emotional skills is one of the core activities of all early care and education programs. Some programs use specific curricula like Second Step. Second step also gets parents and family members involved, which supports some of the other protective factors we're going to talk about later. In the research that was done to develop this initiative, parents reported that the biggest way their child care program affected their parenting was through the social emotional skills their children brought home. When children came home talking about their feelings and with new skills, it makes their parents see them as little people, and it changes how they interact. When a child exhibits challenging behavior, parents can internalize messages that their child is bad, unlovable, or uncontrollable. It is important to provide adequate support to these parents to help them develop coping behaviors and see positives in their child. Help parents to figure out what their child is achieving through use of the challenging behavior. Teacher, parent, and child need to find new ways for that child to express the need and have it met. Some programs make a commitment not to kick out kids with troubling behaviors. They bring in mental health consultation and work with parents to identify the problem and get appropriate services. Crying babies, challenging children, and children with special needs are at the highest risk of abuse and neglect. Parents need information to help them understand the reasons behind their child's behavior, techniques to manage those behaviors and guide development, and perspective. Perspective to put their child's behavior in the context of overall development. For example, intense infant crying is a phase that will pass. Stubborn and independent behavior in toddlers is normal as they develop autonomy. Parents have teachable moments just like children do, usually when their child has presented them with a new challenge or they are trying to tackle a new task like toilet training. Finally, parents need alternative ways of responding to their children than simply the ones they learned from how they were parented, especially parents who were abused or neglected as children, but also for people who grew up in families that over-relied on physical punishment. Most parents will be more receptive to information right when an issue, for example, biting, comes up. Take the opportunity to have a conversation, role model some techniques, and or provide the parent with a brochure or other written information. Role modeling is a great strategy to model new behaviors or to support understanding of developmental issues. Be a role model for parents. Let them watch how you handle their child and other children's behaviors in your program. Formal parent education events will be most successful if they target specific concerns. For example, an event for all parents of 2-year-olds that addresses the so-called terrible twos, or an event focusing on sibling rivalry. Some programs partner with parent education programs in their community so that a parent educator is available to parent during pickup times once a week, or teaches at special parent education events. This should be a win-win situation. Family resource centers and other parent education programs are often seeking ways to reach more parents and raise visibility of their programs. They can't be in every program in the community, but they could be in yours. Always keep in mind that parent education needs to be provided within a context of trust and mutual respect. Parents are receptive when they believe that you know their child and have the child's best interest in mind. Social isolation is strongly connected to child maltreatment. More young families than ever before are living far away from their extended families and need to develop their own social support networks with friends, co-workers, neighbors, and other parents with children of similar ages. For preventing child abuse and neglect, it's not just having social connections, but the quality of the connections. Having someone to talk to and vent frustration, especially about parenting challenges. Connections that help families to access resources, example, a friend that will provide babysitting. Opportunities to see others or other parents parenting. This allows parents to pick up some good techniques and perhaps also recognize some strategies that don't work. Social networks that include positive norms about parenting, conversations with other parents about the joys of raising children, and sharing tips for positive things to do with their children. Child care programs are a primary place where parents of young children meet and develop social networks with other parents. Programs can be intentional about supporting the development of those relationships just by providing space in the program where parents can sit or stand and talk for a few minutes. You can promote social connections. Blending educational and social activities makes it safe for parents who might shy away from purely social events. It also helps to develop or reinforce positive norms about parenting within a social network because they can talk about what they learned. Structured social activities might include a movie night with popcorn and a family movie, or an activity night for parents with child care provided. Often we assume that men will know they're welcome at events, but we don't take any steps to make them feel welcome or make our events attractive to men. Tailor some events toward the men in children's lives. Be open to grandfathers, uncles, and other men who are important in children's lives. Finally, it's important to look at who is not participating in program events and might be socially isolated. Extending a personal invitation to those parents might be enough to bring them in. Staff might sit next to them at first or facilitate connections to other parents during the event. You can be the gateway to services for families when they are in need. Providing concrete supports is an important way of intervening before a crisis happens. Parents that are struggling to meet basic needs for their families will not be able to focus on less immediate concerns like positive discipline and enhancing their child's development. You can support them when they have a crisis in their lives. One way to support them is to give them resources like for food, shelter, and clothing. Assistance with daily needs like health care, education, and job opportunities. Services for parents, depression and other mental health issues, domestic violence, and substance abuse. And specialized services for children, for example, assessment and services for social emotional development problems as we discussed earlier. Times of need don't only occur in families in poverty. All families have times of need, whether it's at the birth of a new child, health problems, etc. Mental illness, maternal depression, substance abuse, and domestic violence can happen in any family. Programs don't need to provide any or all of these services themselves. You can be a resource for families by helping them access the services they need. One important service is just making parents aware of what is available in the community and letting them know that you can be a source for that information. If your county or community has a resource guide, get enough copies so that they can be distributed to all families. If you are having a parent event, invite other community partners to bring information or speak briefly to let parents know about the services they offer. As a first step, you might want to use your time in staff meetings to make sure all the staff are aware of the resources in your community. A referral has more meaning and is more likely to be followed up on when it is offered in the context of a personal relationship. It helps that you know the parent and that you know the person or program that you are referring them to. Don't just give the referral. Follow up. Ask them if they made the call and if they need anything else. For the more interventive services, for example, mental health, domestic violence, substance abuse, the issue is often not only the lack of knowledge about the services, but stigma and lack of trust. Use your trusting relationship with families to help them overcome these barriers and access the services that they need. The point of the Strengthening Families Initiative and the Protective Factors Framework is to focus on the positive things that all families need and things we can all do to prevent child abuse and neglect. However, we all know that abuse and neglect do occur sometimes, despite our best efforts at prevention. Early care and education providers are also important partners in ensuring an appropriate response when a child is maltreated. In Wisconsin, all child care providers are mandated reporters of child abuse and neglect. High-quality training is available on legal definitions of abuse and neglect and how to recognize and respond to warning signs from the Child Protection Center of Children's Hospital and Health Systems, or from your County Child Protective Services office. Ideally, if your center has a strong relationship with CPS, that means you can call when you have concerns and get help to determine whether you need to make a formal report. You are informed when a child in your program is in the child welfare system, and you can work to keep the child in your program despite changes in their home life. You are a partner with CPS workers to help them know what is going on in the day-to-day life of a family that is in the system. Looking back at the protective factors that support and strengthen families and decrease chances of abuse and neglect, there are strategies that early care and education programs can put into practice. One of them is to facilitate friendships and mutual support, strengthen parenting, respond to family crisis, link families to services and opportunities, value and support families and parents, facilitate children's social and emotional development, observe and respond to early warning signs of child abuse or neglect. We've touched on all of these strategies as we discuss the protective factors. As you can see, the program strategies support multiple protective factors at once. The Strengthening Families program self-assessment goes into much more detail about specifics, concrete things programs can do related to each of these program strategies. This is a sample page from the self-assessment, showing some of the concrete things programs can do to facilitate friendships and mutual support. With a team that includes a teacher, an administrator, and a parent, you go through each of these questions and rate how well the program currently does each of these things. Often, parents will have different perspectives than staff, and teachers may have different perspectives than administrators. There are also many options for how to get your program really engaged in strengthening families. Use the self-assessment from your CCR&R agency or online at the CSSP website. Get parents involved in your efforts. Share materials with a group of parents and ask for their input on what your program could do differently and what they would find helpful. Get to know your community partners, from food pantries to child protective services, so that you can be more confident in making referrals to services. Make sure all the staff at your program know about community resources that are available. On this slide are some of the tools and resources that you can access regarding the information from this presentation.